When it comes to lowering blood pressure naturally, most people think of cutting back on salt or avoiding processed food. But there's another side to the story, one that's sweet, colorful, and delicious. Fruit. Fruits are nature's medicine, packed with vitamins, minerals, fiber, and powerful plant compounds. Certain fruits can help lower blood pressure by relaxing blood vessels, reducing inflammation, and balancing sodium levels with potassium. And for people over 50, adding the right fruits to your daily routine can be one of the easiest, most enjoyable ways to protect your heart. What's surprising is how many people skip fruit because they're worried about sugar. But not all sugar is created equal. The natural sugar in fruit comes with fiber and nutrients that actually support blood pressure regulation, unlike the refined sugars in processed snacks that only spike your levels. In this video, we'll explore 9 fruits that are scientifically shown to help keep your blood pressure in check. Whether you're already on medication or just want to avoid the risks of hypertension, these fruits can play a powerful role in your daily routine. Let's discover how to use fruit not just as food, but as a tool for lifelong heart health. 1. Bananas. Bananas are often seen as a simple snack or a quick breakfast option, but they are actually one of the most powerful fruits you can eat to help manage blood pressure. Their key strength lies in one essential mineral that many people, especially those over 50, aren't getting enough of: potassium. Potassium plays a direct role in lowering blood pressure by balancing out the negative effects of sodium in the body. It helps your kidneys flush out excess salt through urine, which in turn reduces fluid buildup and the pressure that builds in your blood vessels. This mineral also helps relax the walls of the arteries, allowing blood to flow more easily and reducing the strain on the heart. One medium banana contains about 420 milligrams of potassium, which is a meaningful step toward the recommended daily intake of around 3,500 to 4,700 milligrams. But it's not just potassium that makes bananas beneficial. They also contain magnesium and fiber, both of which contribute to heart health by supporting better circulation and keeping cholesterol levels in check. For seniors, bananas are especially valuable because they're easy to digest, naturally sweet, and require no preparation. They can be eaten alone, sliced into oatmeal, blended into smoothies, or paired with a handful of nuts for a heart-smart snack. However, as with anything, moderation matters. Bananas do contain natural sugar, so it's best to enjoy them as part of a balanced diet. 1 or 2 bananas a day is more than enough to reap the benefits without overdoing the calories or sugar. Another advantage is their versatility. Green bananas have more resistant starch, which can help support digestive health and blood sugar stability, while ripe bananas offer quick energy and are especially helpful if you're physically active. The best time to eat a banana is in the morning or before light exercise. They give you energy while helping your body gently regulate blood pressure, thanks to their mineral-rich profile. In short, bananas aren't just convenient. They're a daily opportunity to support your heart and lower your blood pressure naturally, one bite at a time. 2. Berries. Berries may be small, but when it comes to supporting heart health and keeping blood pressure in check, their impact is enormous. Whether it's blueberries, strawberries, raspberries, or blackberries, these colorful fruits are rich in powerful compounds that nourish your cardiovascular system from the inside out. One of the most impressive benefits of berries is their high concentration of antioxidants called anthocyanins. These are the pigments that give berries their deep blue, red, and purple colors. But beyond appearance, anthocyanins work within your body to improve blood vessel function, reduce inflammation, and lower the risk of arterial stiffness, a key contributor to high blood pressure, especially in older adults. Berries are also packed with vitamin C and fiber, both of which play essential roles in heart health. Vitamin C helps strengthen blood vessels and prevent oxidative damage, while fiber helps balance cholesterol and support healthy blood sugar levels. Two more important factors when managing blood pressure naturally. What's particularly helpful about berries is that they're low in calories but incredibly high in nutrients. A single cup of fresh blueberries, for example, contains about 80 calories but provides around 4 grams of fiber and an impressive antioxidant load. This makes berries a perfect daily choice for seniors who want to eat lighter but still fuel their bodies with healing foods. They're also incredibly versatile. You can sprinkle them over yogurt, blend them into smoothies, add them to oatmeal, or simply enjoy a handful as a refreshing snack. And if fresh berries aren't always in season, frozen berries are just as effective. In fact, they're often picked and frozen at peak ripeness, preserving all their nutritional benefits. One of the most exciting findings from recent studies is that regular berry consumption, just a few servings per week, has been linked to lower blood pressure readings and reduced risk of heart attacks. That means you don't need to eat them every single day to see results, although doing so certainly helps. When you reach for berries, you're not just satisfying your sweet tooth in a healthy way. You're actively giving your heart the nutrients it needs to stay strong, flexible, and protected well into your senior years. 3. Kiwis. Kiwis may be small and slightly fuzzy, but they pack a serious nutritional punch when it comes to supporting healthy blood pressure. Often overlooked in the fruit aisle, this bright green fruit is a heart-healthy powerhouse, especially for those over 50 looking for a natural and tasty way to manage hypertension. One of the most compelling reasons to eat kiwi regularly is its potassium content. Just one medium kiwi provides about 215 milligrams of potassium, a mineral your body needs to help regulate blood pressure by counteracting sodium's effects and relaxing blood vessels. Potassium helps your kidneys filter out excess salt, which in turn lowers the volume of fluid in your bloodstream and eases pressure on artery walls. But kiwi's benefits don't stop at potassium. It's also extremely high in vitamin C, even more than an orange. This antioxidant is vital for reducing inflammation and improving the flexibility of blood vessels, which is crucial for healthy circulation and maintaining stable blood pressure levels. Kiwis also contain natural compounds known as bioactive peptides, which studies suggest may help reduce blood pressure by acting similarly to ACE inhibitors, a type of blood pressure medication. These natural peptides can help dilate blood vessels, making it easier for blood to flow and reducing strain on the heart. For seniors, kiwis are gentle on the digestive system and easy to incorporate into meals. You can slice them into a fruit salad, blend them into smoothies, or simply scoop them out with a spoon. Their refreshing taste also makes them a great addition to yogurt, oatmeal, or cottage cheese. Just make sure your dairy choices are low in sodium. Interestingly, research has shown that eating just 3 kiwis a day may have a more significant impact on blood pressure than an apple a day. In a study of adults with mildly high blood pressure, those who ate kiwis daily had noticeably lower readings compared to those who didn't. Their high water content also makes them a hydrating fruit, helping to support kidney function and overall fluid balance in the body. When you choose kiwi, you're not just enjoying a sweet, tangy fruit. You're giving your heart a natural boost with every bite, without the need for pills or supplements. 4. Pomegranates. Pomegranates are often called a superfruit, and when it comes to heart health and blood pressure control, that title is well deserved. Inside their ruby red seeds lies a rich source of antioxidants and plant compounds that can protect your arteries, reduce inflammation, and help your body maintain steady blood pressure, especially as you age. One of the most impressive qualities of pomegranates is their polyphenol content, especially a group called pomegranates. These powerful antioxidants are known for their ability to fight oxidative stress, which is a major contributor to stiffening arteries and rising blood pressure. Pomegranates not only protect the lining of your blood vessels, but also encourage the production of nitric oxide, a compound that helps those vessels relax and expand, improving circulation. Several studies have found that drinking pomegranate juice daily can significantly reduce both systolic and diastolic blood pressure. In some cases, the effect is comparable to that of mild blood pressure medications, without the side effects. For people over 50, whose risk of hypertension increases with age, this makes pomegranate an excellent addition to the daily diet. Pomegranates also contain potassium, which helps flush excess sodium from the body, and vitamin C, which supports overall heart and immune health. Together, these nutrients help reduce the internal strain on your cardiovascular system and promote better long-term function. You can enjoy pomegranate seeds, also called arils, on their own or sprinkle them over salads, oatmeal, or yogurt. Pomegranate juice is another easy option, but be sure to choose 100% pure juice with no added sugars or sweeteners. Even though the juice is naturally sweet, it won't cause a rapid blood sugar spike the way processed, sugary drinks do, thanks to its fiber and polyphenol content. For seniors, pomegranates offer more than just heart benefits. They also help reduce joint inflammation, support memory, and even aid in digestion. And because they're seasonal in the fall and winter months, they can bring variety and color to your diet when other fruits may be less available. Every pomegranate is a little treasure chest of nutrients your heart will thank you for. Add it to your routine, and you're giving your cardiovascular system a delicious and natural edge. 5. Oranges. Oranges are among the most familiar and widely consumed fruits in the world, and for good reason. They're juicy, sweet, and refreshing. But beyond their flavor, they offer some serious benefits for your heart and blood pressure, especially if you're over 50. At the top of the list is vitamin C, and oranges are absolutely packed with it. This powerful antioxidant helps protect your blood vessels from damage, reduces inflammation, and supports stronger, more flexible arteries. And when arteries stay flexible, blood can flow more freely, which naturally keeps your pressure in check. But the real secret weapon of oranges lies in their potassium content. One medium orange provides around 240 milligrams of potassium, a mineral that balances out sodium and supports the body's ability to control blood volume and vascular tension. The more potassium you take in through whole foods like oranges, the easier it becomes for your body to release excess sodium through urine. Oranges also contain magnesium, another mineral that plays a subtle yet powerful role in blood pressure regulation by helping blood vessels relax. Together, this trio of vitamin C, potassium, and magnesium makes oranges one of the best everyday fruits for heart health. Another hidden advantage of oranges is their fiber. Eating whole oranges instead of drinking orange juice gives you dietary fiber that slows down sugar absorption and helps control cholesterol levels, both of which are crucial when managing high blood pressure. In contrast, many store-bought juices contain added sugars and lack the fiber needed to keep your blood sugar and insulin levels stable. If you're craving citrus in liquid form, consider fresh squeezed orange juice in small amounts, ideally diluted with water or paired with a meal to blunt the sugar spike. Or even better, eat an entire orange or slice some segments into a salad or your breakfast bowl. The bright color of an orange signals the presence of flavonoids, plant compounds that reduce inflammation and improve endothelial function, meaning the inner lining of your arteries stays smooth and reactive to blood flow demands. Oranges are more than just a quick snack. They're a daily habit that delivers real benefits for your blood pressure and your long-term heart health, all in a package that's naturally sweet and satisfying. 6. Avocados. Avocados may not be sweet like other fruits, but they are one of the most heart-protective foods you can add to your diet, especially if you're concerned about high blood pressure. Rich, creamy, and full of healthy fats, avocados deliver a unique nutritional profile that supports balanced blood pressure from multiple angles. One of the standout nutrients in avocados is potassium. In fact, avocados contain more potassium per serving than bananas. Just half an avocado can provide around 350 to 500 milligrams of potassium, helping your body flush out excess sodium and ease pressure on artery walls. This is especially important for people over 50, as the body becomes more sensitive to sodium with age. In addition to potassium, avocados are high in monounsaturated fats, the kind of fat that supports healthy cholesterol levels and reduces inflammation in the blood vessels. These healthy fats help keep arteries flexible, improve circulation, and lower the risk of plaque buildup that leads to heart attacks or strokes. Avocados are also a great source of magnesium and fiber, two more nutrients linked to better blood pressure control. Magnesium helps blood vessels relax and function properly, while fiber improves cholesterol profiles and supports a healthy gut, which is increasingly recognized as an important part of cardiovascular health. What's more, avocados are naturally low in sodium, making them an ideal choice for those following a heart-healthy, low-salt diet. And because of their creamy texture and mild flavor, they can be used in countless ways. Mashed on whole grain toast, blended into smoothies, diced into salads, or even used as a healthy replacement for mayonnaise or butter. Many seniors worry about the fat content in avocados, but it's important to remember that not all fats are harmful. The fats in avocados actually help the body absorb fat-soluble vitamins like A, D, E, and K, all of which play roles in maintaining strong blood vessels and reducing inflammation. Including avocados in your routine doesn't just improve taste and satisfaction. It gives your body the tools it needs to regulate blood pressure naturally, one creamy green bite at a time. 7. Watermelon. Watermelon is more than just a refreshing summer treat. For people over 50, it offers real cardiovascular benefits, especially when it comes to supporting healthy blood pressure levels. The star compound in watermelon is called citrulline, a natural amino acid that helps your body produce nitric oxide. Nitric oxide relaxes and widens blood vessels, improving circulation and making it easier for blood to flow, which in turn lowers blood pressure. This makes watermelon a surprisingly powerful ally for those managing hypertension. Watermelon is also incredibly hydrating, with over 90% water content. Staying hydrated is essential for maintaining healthy blood volume and kidney function, both of which contribute to stable blood pressure. And because it's so hydrating, watermelon is also naturally low in calories while still feeling satisfying. In addition to citrulline, watermelon contains potassium and magnesium, two minerals that work together to help balance fluids in the body and keep blood vessels functioning properly. These nutrients support your heart by reducing sodium's impact and promoting relaxation in the arteries. Whether you enjoy it sliced, cubed, or blended into a smoothie, watermelon is easy to add to your diet and brings a touch of sweetness without the health risks of processed sugar. For older adults, watermelon is a gentle, easy-to-digest fruit that works with your body, not against it, to maintain steady, healthy blood pressure. 8. Grapes. Grapes may be small, but they pack a powerful punch when it comes to supporting heart health and lowering blood pressure. These juicy, bite-sized fruits are rich in antioxidants, especially a group called flavonoids, which help protect your blood vessels and improve overall circulation. One of the most important flavonoids in grapes is resveratrol, found mainly in red and purple varieties. Resveratrol has been widely studied for its ability to relax blood vessels, reduce inflammation, and prevent damage to artery walls, all crucial for keeping blood pressure under control as we age. In addition to antioxidants, grapes provide a good amount of potassium, which helps offset the effects of sodium and supports fluid balance in the body. This is essential for maintaining a healthy pressure within your arteries and reducing strain on the heart. Grapes also contain fiber and water, both of which help with digestion and contribute to satiety without adding excess calories. And because they're naturally sweet, grapes make a heart-healthy alternative to sugary snacks and desserts that can cause blood pressure to spike. For older adults, grapes are an easy, no-prep option that can be eaten as a snack, added to salads, or even frozen for a cool, satisfying treat. By making grapes a regular part of your diet, you're not only enjoying a sweet, refreshing fruit, you're also giving your cardiovascular system daily protection in a form that's simple, natural, and delicious. 9. Apples. Apples are one of the most accessible and versatile fruits, and they quietly deliver powerful support for heart health and blood pressure management, especially for adults over 50. Their benefits come from a combination of fiber, antioxidants, and plant compounds that work together to keep your cardiovascular system in balance. One of the key nutrients in apples is soluble fiber, particularly pectin. This type of fiber helps reduce cholesterol levels by binding to excess fats in the digestive tract and removing them from the body. Lower cholesterol means less buildup in the arteries, which helps maintain smooth blood flow and prevents pressure from rising. Apples are also rich in polyphenols, especially a flavonoid called quercetin. Quercetin has been shown to have anti-inflammatory and antihypertensive effects, meaning it helps lower blood pressure and reduce strain on the arteries. These antioxidants also fight oxidative stress, a condition that can damage the lining of blood vessels and increase the risk of hypertension over time. Another bonus is the potassium content in apples, which supports sodium balance and promotes healthy fluid levels in the body. Eating apples with the skin on gives you the most nutritional benefit, as that's where much of the fiber and antioxidants are concentrated. Whether eaten raw, sliced into oatmeal, or baked into a healthy dessert, apples are a low-calorie, high-impact addition to any heart-smart diet. Simple, familiar, and easy to find. Apples are everyday allies in your journey toward lower blood pressure and a longer, healthier life. Which of these fruits do you already enjoy? And which one are you excited to try after learning their heart benefits? Let us know in the comments. Your insight might help others make smarter choices too. If this video helped you better understand how to eat for lower blood pressure, give it a like and consider sharing it with someone you care about. And don't forget to subscribe to Active Health Care. We're here to bring you simple, powerful ways to live longer, feel better, and protect your heart, all through everyday foods and habits that truly work.